This presentation is on family assessment. Family assessment is a broad term because counselors might want very diverse information depending on the family's problems or issues. There is not just one area of focus in family assessment because the focus could be on couple satisfaction, the identification of communication patterns, perceptions of the family environment, self-reports of behavior, an analysis of relationships, the identification of problems, or many other familial aspects. A family assessment device or technique could be extremely helpful in identifying the issues in one family, but not appropriate for another family. One of the major modes of assessing families is through interviewing. In interviewing a family, the counselor needs to establish rapport and encourage family engagement. Family engagement is closely associated with joining the family or establishing a therapeutic alliance. Engagement provides the foundation for future interventions. Regarding interviewing families, it sometimes is important to note that several studies have found important difference among family members' reports of family functioning. Observation is often used in all types of assessment, but it is particularly important in the assessment of couples and families. Interviewing couples and families can often provide information about family characteristics and dynamics. Interviewing families is complex as the clinicians must not only ask clinically relevant questions, but also observe all family members while conducting the interview. The interview, however, can often provide insights into family dynamics that may be corroborated by other assessment strategies. Other forms of family assessments are mapping techniques. Mapping techniques are where the counselor has the family collaborate with the counselor in graphically representing some pertinent representation. The most widely used of the mapping techniques is the family genogram. Counselors use mapping techniques to gain information and also to observe the family dynamics while the mapping technique is being completed. Genograms offer an assessment technique often incorporated into counseling with couples and families and are probably the most well-known assessment procedure in family counseling. Counselors work with families to help them draw a family tree that records information about family members and their relationships over at least 3 generations. Genograms can help identify which family patterns are being repeated by the family who is completing the genogram. With genograms, the clinician examines the previous generations and looks for patterns of functioning, relationships, and structure. A basic assumption with the use of genograms is that problems and symptoms reflect a system's adaptation and reaction to its context. Typically, the counselor asks questions about family structure and maps the genogram for the past 3 generations. The mapping is a graphic depiction of how family members are biologically, legally, and emotionally related to one another over 3 generations. Once the skeleton of the genogram is assembled, the next step generally is to record family information, which can include demographic information, functioning information, and critical family events. Demographic information includes marking the year of each individual's birth and the year of death. Dates of marriages and divorces are also recorded on the genogram. After mapping the family structure, the clinician begins to gather information related to patterns of functioning. Critical family events such as losses, successes, or transitions are also recorded. If an event is deemed, excuse me, let's see, I lost my place. If an event is deemed particularly noteworthy, a counselor may map it in the genogram and note it again in the margins. The theoretical foundation of genograms is that family patterns are repeated. Thus, the clinician gathers insights into current problems by examining previous family functioning. Interpreting the genogram often involves constructing hypotheses that are later examined with the family. The counselor examines the relational structure and variables, such as whether the composition of the household is a nuclear family, the involvement of extended family, the order of the siblings, and any unusual family configurations. The family life cycle and stage should also be considered in the interpretation. Some psychometric limitations need to be considered before using a genogram. Doctoral students varied greatly in their accuracy in recording family information on genograms. This finding is even a little more disturbing because these advanced students had been trained in how to construct genograms. It should also be stressed that there is very little validation evidence for genograms. Therefore, clinicians should be extremely cautious in the conclusions they reach based on genogram information. Similar to other observational techniques, genograms are particularly susceptible to counselor bias. Counselors need to view their interpretations of genograms as only hypotheses that need to be confirmed or invalidated by gathering additional information about the family. Another mapping technique that has been historically associated with family therapy is family sculpting. Family sculpting emerged Excuse me, I have really small text. Family sculpting emerged in the late 1960s as a method to assess and intervene with families. There is considerable subjectivity and inconsistency in family sculpture, but Cromwell, Fournier, and Quebec developed the Quebec family sculpture technique, which is more structured than most sculpting techniques. This technique uses a board that is similar to a chessboard, except there are 100 squares. The family members are instructed first individually and then as a family to place figurines on the board depicting the relationships among the family. The family first represents the relationships as they currently exist and then sculpts the family again from an ideal perspective. The counselor assesses the sculptures by measuring the distances between the various placements of the figurines. Marriage and family therapists use sculpting techniques with a variety of objects, including family members arranging them themselves in the room to depict their relationships. It is important to remember that sculpting techniques tend to be unreliable. Relationships within a family are fluid, and these techniques reflect only the client's current perspectives. Therefore, counselors need to be cautious in interpreting this information and should not consider it a stable representation of the family. These are some major assessments used for the family group, including the development, validity, norms, and limitations of these measures. Relationship dynamics between family members can vary. Relationships between mothers, fathers, daughters, sons, sisters, brothers, and other family members who may be part of the family unit vary widely. Family relationships can be the sources of the greatest joys in life, but they can also be the cause of the greatest distress and sorrow when things go badly. Many marriage and family therapists or counselors use a systemic approach when working with couples of families. A systemic approach is holistic with a focus on the interactions that occur and the belief that all members of the family interact and influence each other. According to this philosophical view, assessment would not be of individuals, but would focus on the dynamics or patterns that occur within the couple or family. Thus, testing each member within the family individually is not consistent with this systemic view. Thank you.